have been using the UltraPulse for at least 8 years. We use it for a number of indications. A lot of it for hypertrophic scarring, for skin rejuvenation, for acne scarring. And we have started also using it for some radiation fibrosis as well as a new potential treatment for radiation injury. In terms of radiation dermatitis, we actually do not know very clearly the prevalence of radiation dermatitis. However, there is a published article in the New England Journal of Medicine speaking about the number of patients affected by chronic radiation injury, particularly in breast cancer patients. And the data thinks that it's about 33% after 10 years of the patient who have had breast cancer and treated with radiation develop some form of chronic radiation injury. We don't know particularly the types of the radiation injury, whether it's telangiectasias, fibrosis, combination of both, hyper or hypopigmentation, but definitely a large number of patients are affected. And there seem to be about at least more than 10 million worldwide patients affected by breast cancer. This statistic does not include patients who suffer from head and neck cancer, lung cancer, sarcomas, or other kind of cancer, which are also high likelihood of developing chronic radiation injury. Unfortunately, because there has been no movement towards treatment options for these patients in the past, they are not aware that there's something we could potentially do. Therefore, we are not getting referred these patients from the oncologist or radiation oncologist. And so awareness need to be raised with the medical community about potential treatment options that are been proven and under study for these patients and to help them having a better quality of life. Actually, the reason why we got interested in using the UltraPulse for chronic radiation injury is termed from our humanitarian effort. We actually started a clinic in Vietnam in 2009 to treat children with hemangiomas. And these children at the time was being treated with radiation, radioactive phosphorus in the treatment of hemangiomas with great chronic radiation scars on their skin. They have fibrosis, depigmentation, telangiectasias, as well as xerotic skin, changes in texture that can affect their function. They also have a lot of contractions of those scars. And Luminous is one of the companies that were very helpful. Luminous donated a device, an UltraPulse CO2 device, to an organization, which is a 501(c)(3) nonprofit organization founded with conjunction with Dr. Rox Anderson, Dr. Martin Mim, Dr. Stuart Nelson, and Dr. Thuy Phụng, who are physicians from the U.S. With the donation of the device, we were able to look into potential treatment options, and one of them was for scars. So when we look at these patients, we see, there's a lot of scarring and fibrosis, and we know that the UltraPulse has been used successfully to treat hypertrophic scars. So we started to think whether there's a possibility of using the UltraPulse to treat radiation scar, because there is no treatment for these patients and they have to live with this horrible disfigurement for the rest of their life. So that was the motivation for us for using the UltraPulse to treat radiation scars. So we do combine the UltraPulse treatment with other modalities depending on what kind of scars we are looking at, whether it's hypertrophic or atrophic, whether it's radiation scar, whether there's significant amount of telangiectasias. So most often for hypertrophic scar, we combine that with using topical triamcinolone, at least 40 milligram per ml, and apply directly on top, or we can even use clobetasol gel in the past for hypertrophic scar with really good results. We have also combined the use of fractional CO2, the UltraPulse, with a pulse dye laser, as well as a new process where, particularly for radiated patient, to combine the UltraPulse with epidermal grafting of skin on top of this radiation scar. And the epidermal grafting basically is the creation of small little suction blisters, and then transfer that onto the disease area to replace the epidermis. And we actually use the Active FX handpiece on the UltraPulse to remove the epidermis and then subsequently transfer the suction blister on top of that area and create a really nice wound. I actually really like that technique. We do treat keloidal scars. Yes, there is no particular consensus on the treatment options for keloidal scar, but we do find that the ultrapulse can be very useful in combination of treatment. Intralesional steroids is still a very first-line options, but if you have an ultrapulse available, secondarily treating the advantage, you can treat the telangiectasia. You can also treat a little bit of the atrophy, steroid atrophy afterwards, because intralesional steroid can create a lot of atrophy. So we do use the ultrapulse in combination with applied topical steroids, a high potency one, at least triamcinolone or clobetasol. In terms of anesthesia for ultrapulse treatment, we do actually use the different combination depending on the patient and where we are at. For children, we like 7% lidocaine ointment applied for at least 30 to 60 minutes prior to treatment options. We have also used a combination of benzocaine, lidocaine, and tetracaine. It's called BLT for apply at least 45 to 60 minutes prior to treatment. I also actually have patients who don't prefer any anesthesia if they have to do injection anesthesia, which we do sometimes. We sometimes also do nerve block, but some patients actually find that if you have to do injection anesthesia, it hurts more, so they just prefer not to do anything, and they don't think it hurt that much. It's a little discomfort, and they were fine afterwards. In terms of downtimes, patients do usually complain of downtime. We usually warn them it can take between 3 to 7 days for the skin to completely heal, and we give them a regimen of sheets of how they can do soaking at home to prevent infection as well to help with the healing process. However, most patients tell me after 2-3 days all their wounds are healed. They don't have any open wounds anymore, and it's very well tolerated. If depends on which area and how deep you go. If patients have on the face, they may take a few extra days off before going back to work. But if any other parts of their body, they usually be back to work within 3 days. So it's very well tolerated. In terms of the evolution of the scar after treatment, usually the remodeling process, I actually warn patients, can take anywhere between 1 to 3 months. So we don't always expect that the improvement of scar will happen immediately. However, a lot of our hypertrophic scarring patient, and we see this over and over again, and even in some of the radiation dermatitis patient, if we treat an area that's shown to be improved, the improvement usually start about 2-3 days after treatment, which is really amazing. One of our patients who had a large area of radiation dermatitis secondary to metastatic melanoma on his neck. Once we treat the entire area, he emailed me 2 days later and said it's felt much softer, he can move very well. And we observed this again in patient with hypertrophic scar. The increase in movement is actually quite immediate. So we're very happy about that, but I think the remodeling process takes longer. Immediate effect might be because we have reduced pressure in that area. We create these micro zones of injury that redistribute the tension vectors around the scar. And because of this redistribution, by creating tiny holes in the skin, this is what patients are feeling. And then in terms of collagen production, elastic fiber production, and all the remodeling process, that takes months. In terms of the short pulsings of the ultrapulse, that contributing to the effectiveness of the laser treatment, I think that definitely has a component in terms of helping the scar. I do like the ultrapulse a lot. I think the ease of use is really great. It has an ability to, you can do large or small area, you can do different shape and sizes, you can very tightly control which area you can use, and you can increase the densities that you need. And I love the device. I think it's great. So definitely would recommend it to other people.